Hello, everybody. Welcome to Q&A with A&V. I'm Vincent Racaniello, and joining me from New York, Amy Rosenfeld. Hello, Amy.
Hello, Vincent. How are you today?
Well, I'm in my basement studio, which is good because the National Weather Service told me to come here for the tornado warning or watch, whatever it is.
How long is that for?
Until, I think, 10 o'clock, something like that.
I see.
So I'm safe here as long as the power remains. How about you?
I don't know if there's a tornado watch in New York City. I don't think so. But the wind you can hear, and the windows are shaky.
Just as we start.
You know how they go.
Just as we start, my throat gets all scratchy and tickly. And we already have one thumb down and we haven't said anything yet.
Well, they must not like the weather. It's really due to the weather. It's the conversation of the weather.
Before we start, I just wanted to tell everyone that today my podcast with Lex Friedman dropped. So there it is on his YouTube page. I'm so glad he spelled my name right. You can't depend on that these days. Viruses and vaccines. So there's a video version here. It's 3.5 hours. And if you go to his homepage, lexfriedman.com, you can find the podcast, audio only. So I had a good time talking with him. He's he asks very good questions. So please check it out. A lot of people are commenting on it and asking me how I feel. I feel fine. No different. We just passed 92,000 subscribers on YouTube. Maybe we got a little bump. I'm hoping we get up to 100,000 as a consequence. What do you think, Amy?
That would be great. Don't you get some kind of circle, some kind of plaque or something?
Yeah, you get something. You get something when you hit 100,000. So that was a good time because it was a great conversation. He asks good questions, and so because of that, it was fun. But now,
I'll judge if he asks.
You can judge. Now, Amy, who got tested and positive for COVID today?
Joe Rogan, the genius who refuses to get vaccinated. Another genius.
So Lex,
maybe he'd like to, I don't know, give something back. I don't know what he has of any value, but.
Well, in between our recorded conversation, Lex was very defensive of Rogan. He said he's worried about long-term consequences of the vaccine.
Long-term consequences?
Yes.
Long-term consequences. So what defines a long-term consequence? 50 years from now when the guy is 90? How are you going to discern if it has any long-term consequences when you're 90? I can tell you everything breaks when you're 90.
I know. It's just a crazy thing. I mean, the long-term consequences is just, yeah. I mean,
everything breaks when you're 90.
And on the other hand,
if we ask Nick, that everything breaks at 83.
I mean, on the other hand, people are downing ivermectin by the bucket loads, and that has consequences when you overdose, and they don't seem to worry about that. It makes zero sense to me whatsoever.
Oh, it makes total sense. It's because ivermectin's fully FDA approved, and this was marketed as not. It was a poor marketing. People have to think when they make a marketing campaign for what the consequences of the people are going to be. Or actually, consequences aren't the right words. So it's the cheater concept, right? You make a marketing campaign to get people to do X. You have to somehow have built into that campaign the way to convince people who are automatically going to do Y to be doing X, right? So you say, I have a class, I'm going to give an exam. You cannot cheat, right? So you see people cheating. So then you move them every seat away, right? Yeah. Every other seat, right? And then still somebody's going to figure out how to cheat, right?
Of course.
Okay. So, and then you have to come up with a new plan. So it's the same process when you market something like this, and it was not well thought out. It's unfortunate.
In further incubator news, I have been readying it for this month to do the first transmissions. I'm hoping to start the live stream virology course in September. So I think I should be ready in about 2 weeks to record. If it's not perfect, we'll move forward. Right, Amy?
Right.
Doesn't have to be perfect.
Well, speak for yourself.
Okay, let's do some questions. Any inside news on Novavax? I keep waiting for it to receive EUA. People in the trial that started last July apparently still show a strong immune response.
I sent you the Nature paper about Novavax.
Right. That's the phase 3, right?
Yeah.
Yeah.
Yeah. But
And
they can't manufacture it, so it doesn't matter.
right, the manufacturing problems, which is unfortunate, and to which I would say you need to hire Amy. She'll sort it out for you.
I come expensive.
And I want to welcome back Frank, one of our
That's
mods.
very
Thank you,
nice.
Frank. Hello, good evening, and Vanity Nutrition. Welcome back. And I think you're at sea level tonight, right? Okay.
Well, hopefully she's not in undersea level. That's not so good.
And there are a lot of questions that were early in before we started streaming. Those, I don't see those any longer, so you could re-ask them. It would be fine. All right. Jenster wants to know if herd immunity really is a myth.
Seriously?
This is what the press has been, the press has been writing, yes. Many
It's a
people
myth?
are saying it's a myth. Yes. All of a sudden, a principle that has been established for perhaps 100 years is suddenly a myth. Let's
Really?
think about this. Let's just think about how biology has suddenly changed, Amy, to make it a myth.
Do we have biology anymore?
This is my this is a terrible aspect of this pandemic, is that science is out the door. And it's just
The
what people
terrible
say.
aspect of this pandemic that people people have forgotten, and people who are old, even older than you, have forgotten.
Are there
that
people older
many.
than I?
Yes. Older than you make stupid statements like somebody with a Nobel Prize. All right,
Doesn't matter what you have. No, it's not a myth. Herd immunity works. It will work for SARS-CoV-2, despite what you hear in the press. And you did the right thing by asking us. No, it's not a myth.
Not a myth.
We are 5 friends in our 40s to 60s meeting once a week indoors for a few hours, all doubly vaccinated. How can we protect ourselves as schools reopen and cases are bound to go up?
Wear a mask when you're not with the 5 friends and stuff.
Yeah, I mean, but you're doubly vaccinated. You're good.
Yeah,
Sorry, go ahead.
but like they're gonna go out, right? We are 5 friends, so meeting once a week, but you go out, you go shopping. So it's like you wear a mask when you're shopping, but with the 5 friends, it's fine.
All right. Am I planning on interviewing Joe Rogan? I never said that, did I?
You wanted to be on the show. Yes.
I'm
you've
interviewing
said
Lex
that.
Friedman.
No, but you've said that you wanted to be on. This is just a different way of phrasing that you want to be on his show. Are you still
wouldn't mind.
planning on going on Rogan? Is that still your goal?
I would not say no, but it's probably not happening. Nevertheless, I do want to have Lex Friedman on something of mine or ours, okay? So I think he would be interesting to talk about his field, not mine, of course. Richard said, I watched the whole Lex Friedman interview. Wow, pretty good. Would be a good background piece for folks wanting to take your online course. Yeah, I think that would be true. We covered a lot, for sure. Okay, a study found the flu vaccine may protect against severe COVID. You hear about this, Amy?
No.
I just don't see how, remember last year, Amy, there were some replication competent vaccines that thought give you a couple of months protection against COVID, OPV,
Yeah, MMR.
MMR.
Yeah, but that's
So,
all non-specific innate immune responses.
yeah, just for a few months. So if it was flu mist, it's possible. But Random Dude wants to know if COVID vaccines could protect against severe flu. I don't think so. Do you, Amy?
Well, if you got it in the same fashion to boost your innate immune response, but why would you do that?
Yeah, good question. I'm fully vaxxed. Would I be better off getting an infection now and getting better immunity, but extremely low risk of serious disease to get better immunity in case a worse variant in the future? I don't think you should try and get infected. But if, so we don't know if, to turn this around, we know that people who recover from infection and get one vaccine dose have a broader antibody response. We don't know if the opposite is true. If you're vaccinated first and then get infected, do you get a broad immune response?
Well, why would you? I mean, why would you? You have an aborted infection.
Yeah, in the case of infection followed by vaccination, the first is not an abortive infection. That's a great point. Yeah.
So I don't know why you would do that. I saw something today about this, and I thought that they had a really good point, but now I've forgotten. All right. Well, if the window's fallen on me, it's been nice knowing you.
There's a lot of wind there.
I mean, the windows are shaking. The wind just got to be going like, I don't know, 30 miles an hour. Whatever wind does.
We don't hear it. That mic is so excluding. Yeah, we can't hear it. But Amy, do you remember when Fauci was on Twiv? He said he feels that, for example, when you get vaccinated against influenza, you get infections every year that boost your immunity.
Yeah, but they're not necessarily. So it's not the same analogy because the flu vaccine is a guess against what is circulating, right?
Right.
So I don't anticipate it to be as effective as something that does not have as great a diversity as flu does. And SARS-CoV-2 doesn't really have that same diversity.
Okay. Fair enough.
Do you know what I'm saying?
I do.
So, yeah, it's a guess about all the different variants of flu that are circulating. Whereas these are variants by 2 amino acids that don't really change very much. And especially in a polyclonal sera and T cells. And the vaccine is really against T cells, right? It's really to stimulate T cell memory, T cell production.
Yeah, that's the idea.
And response. So, yeah, and T cells suck during influenza and vaccine. Isn't that what he said? Is that there was no T cell response?
Yeah, it's just really poor, yeah.
Yeah, so again, I don't know that I would use that as an analogy.
Okay, continuing from last week, if it's not a high antibody titer that confers immunity, can we have a conversation about what does? All right, so first of all, Patricia, when you say confer immunity, you have to tell us what you're conferring immunity against what? All COVID, asymptomatic, mild, moderate, severe, death. It makes a difference. It looks like antibodies correlate with protection against mild COVID, but T cells correlate with protection against severe COVID. So as antibody titers are waning, people are still surviving. They're not getting serious disease because the T cells are still protecting them.
Well, I would think that if you were vaccinated and you got infected, the T cells and the B cells are protecting against mild disease.
Well, in the paper we did Tuesday on Twiv, which you had sent to me, it's the correlates of protection modeling.
But they totally ignore T cells at the very beginning of the response.
They do. But they do show that 20%, so they get a number of 20% for the antibodies to prevent any COVID. 20% of the level of neutralizing antibody that you see in convalescent sera. Only
which works
3%.
so well.
That's right. It's got a neutralization titer.
So let me get this straight. You're going to tell me that I need 20% of the number of the level of antibodies in convalescent sera that does not work at all to prevent COVID.
But it does have a neutralizing titer. You can measure it. And get this, Amy. Get this. They agree that convalescent isn't even uniformly defined. What is convalescent, right? I knew it would make you laugh. I knew it would make you laugh.
Because it's just so sloppy and so ridiculous. Oh, this is what I was thinking. So, Hinton, because of this idea about the breadth of antibody responses due to natural infection versus these mRNA infections. So he tweeted, he and Raul must not be so happy. So he tweeted how this idea of natural infection producing a wider breadth of antibodies than the vaccine, which is against what like Daniel said and Ho and everything, is a reason why we should have live attenuated vaccines. And he actually has a really good point about that. That is true.
What do you think is the reason? Because you have a lot of viral proteins involved?
Yeah.
Yeah, not just one.
And not just one. And then you have it in the appropriate context with membrane and matrix that are all part of the envelope and everything. And so he and Raul are actually 100% correct.
Here's one for you, Amy. What do the proteins in ORF1A and B do?
They are the replication proteins. They are the proteins that encode for the polymerase and all the proteins that are necessary to make the replication complex.
Yep.
Do we understand what their roles are? We understand what their most obvious roles are. Now, if they have subtle roles as non-proteolytically fully processed proteins, we do not know.
New paper out from Drosten providing evidence for waning immunity to COVID, including T cells in the elderly after the BioNTech vaccine, suggesting booster. Thoughts? Why does that suggest a booster? What's the waning immunity to what? Asymptomatic, all COVID, mild, moderate, serious? You have to define it. If people are not getting sick, did you send it to me?
Yeah, it's in the folder.
Okay.
It came out earlier this week. Wow. Huge lightning.
We'll take a look. But I'm skeptical because I don't care about waning. I just want to know about protection against severe disease.
Well, they were equally as efficiently protected, so I'm not really buying it.
This idea of booster needed for waning immunity is ridiculous because all vaccine immunity wanes. And we don't give boosters to every vaccine, right?
Well, so the problem is that when all the other vaccines were developed, people actually understood immunity back in the Dark Ages. You know, when we were cavemen?
I remember
that?
It well.
About 10 years ago when we were cavemen in the Dark Ages?
I remember
it
well.
Seen the Enlightenment.
Yeah.
It's like the Renaissance.
What are your guesses of the percentage of folk in the U.S. getting a third jab? Well, a couple of weeks ago, Daniel said 1 million people had already gotten a third. So maybe, I don't know, maybe 2 million. I don't know.
No, I would say it's a percentage. 2 million is not a percent. I would say approximately 30% of the population has already gotten a third jab.
When the media seeks scientific experts about COVID, why do they bypass virologists in favor of epidemiologists, general physicians, evolutionary biologists, and even cardiologists? That's a great comment, Golf Grouch. It's just so on point.
Yeah, but do you know why they bypass the virologists in favor for all of these other people?
Why, Amy?
Take a guess. It's pretty simple.
Because the virologists tell the truth and it's not so exciting?
Right. It's not the scaremonger. It's not going to sell them papers.
Yeah, all these people are on Twitter. They're fostering scaring.
But even before they got on Twitter, or before their Twitter handles exploded, they were all used. And that's because they are going to tell you something that is going to sell you papers. And as I said, when we discussed a certain evolutionary biologist, who I don't believe is anything more than an evolutionary biologist in the context of like how an organism actually develops.
Yeah.
You know, how we came out of the water, how we fly, the relationship between arms and wings, and blah, blah, blah. So, but they see evolutionary biologists, and he will just whore himself out to talk about how molecular clocks work and how viruses evolve, when it's a completely different process when you're talking about that versus how, you know, we went from the 2-chamber to the 3-chamber to the 3.5-chamber to the 4-chamber heart that you and I have today. It's a totally different process.
I was on CNN in February of 2020. They never had me back because I just told them the way it was.
Yeah, and you said something that, what's his name? Sapta Gupta, whatever his name is.
Sanjay Gupta.
Yeah, whatever. Whatever his name is.
No, he didn't like it. That's the end of Vinny. And I've had issues. I've had issues with New York Times writers about running stories and talking to the same tired people over and over, like people with bow ties, and they tell me I'm wrong, and I'm the virologist. Amy's the virologist, so we just do our thing.
She complained that we were the only people who were complaining, and then when she went to talk to somebody that we suggested, he was not. He was wishy-washy is the nicest way I can put it.
Yeah, that's true.
He was very, very wishy-washy. It was very disappointing.
Here's our first super sticker for the night. Thank you, German opera singer. Really appreciate it. I still can't get the money out of Google AdSense. I finally wrote somebody high up at Google today, Amy.
Oh!
And I said, Jack, I can't get my money. Can you please help? Because there's nowhere to turn on your stinking website. Actually, I didn't say stinking. Let me get this straight.
When I suggested this 3.5 months ago, it was not a good idea.
No, it took time for it to percolate into my brain, Amy.
Okay. Percolate away. When do you think the coffee will be done? Will it be
John
done
Snyder.
In the morning for me to have, or should I wait a couple of days?
Amy, it just takes me time to come around. That's all. What was my daily rant? Are you talking about the Reddit AMA? So I did a Reddit AMA today. I'm going to try and do it every Wednesday. Got a lot of great questions. I don't know. Did I rant? I might have ranted. Yeah. Oh, someone on this AMA said, when are we going to start going after natural immunity and thinking about the effect of face masks on a child's developing brain? To which I said, how about if we did a study on the effect of being in a hospital?
Wait a minute. Maybe the person would like to listen to David Kimberlin, who is on the Andy Slavitt podcast last week, on Monday, who is one of, I mean, I have issues with him for other reasons, but he's actually a phenomenal pediatrician out of Alabama. He's well respected. He's well read. He's very smart. He's been doing it for like 22 years. And he flat out says there is no damage to wearing a mask for any child. Like, this is just total ludicrousy. Okay. So David Kimberlin, Children's Hospital, University of Alabama, everybody should go listen to the Slavitt show if they're concerned about children and masks, because he's very clear. Put on a mask.
It's better than getting in a hospital. All right. When a person gets infected with a specific variant, do T cells made protect that person for other variants like the protections the vaccines provide?
Yes.
Yeah, they do, because the parts of the virus proteins that the T cells recognize don't change in the variants. So they can recognize all variant infected cells. Yep. Oh, here's the source of herd immunity, John Campbell. Okay, so I know a lot of you like John Campbell. He doesn't know anything about immunity or herd immunity. That's why he says it's out the door. That's a
But
ridiculous
look,
statement.
they're running for the gin bottle. If
Well,
they
that's
could
maybe
only
that's
send,
fine.
if they could only send it this way. it
I
would
hope
be
it's high. I hope it's high-end gin, Amy.
Yeah, I just read a whole article about different gins. and
My
they'll
favorite
all
gin
take them
is Hendrix. Do you like Hendrix, Amy?
I do like Hendrix, but I also like things that have a little bit more juniper.
So that's why John Campbell has 1.5 million subs and we have 92,000, because he fearmongers, and people love it.
That's fine. As somebody suggested that I would massage my data to tell the story that I want to tell, even though it doesn't fit. I don't do those kind of things. I'm crabby for sure, but well, actually, I'm not crabby, but I don't fearmonger.
Can you comment on original antigenic sin and the likelihood of this phenomenon interfering with effective immune response to theoretical future variants? Any thoughts, Amy?
I'm waiting for antigenic sin to occur.
Yeah, it has not occurred with SARS-CoV-2. It happens with certain isolates of influenza virus. You make a better response to the first virus you ever saw, and that doesn't seem to be the case here. And as I said, the variants are handled quite well in terms of disease by the immune response, so I don't see where that's an issue. A lot of people at my healthcare are already talking about the third shot. I don't want it at this point. I'm starting to feel a bit defensive. Yes, it is like every other thing. I'm not going to use the N word because people don't like it anymore,
That's right.
including Amy, and I will respect people's desires.
No, this
but,
is just total peer pressure. This is
peer
like
pressure.
when you're in high school. Here,
Yeah.
smoke a joint.
Do
Even
what
though
you want.
you don't want it. Here,
Look.
smoke a joint. You're gonna be a
If you want
you
a
can't
third
be
shot,
my
get it.
friend.
If you want a third shot, get it. I'm just telling you, we just tell you why the science says you don't need it right now.
Yeah. I mean, Paula. So my friend's husband's mother is talking about getting a third shot. So Paula says she needs a third shot. So he calls. He's like, does she need a third shot? I said, no. She said, but she's immune compromised from back surgery. I was like, she's immune compromised from back surgery?
Really? Oh, that's a new one.
I was unaware that there was a lot of, removal of lymph nodes when they put in screws. But what do I know? I'm not an orthopedist.
Okay, all these people. Hotez, Campbell say even 100% fully vaccinated population is not strong enough. They're wrong. They're totally wrong. I mean, they don't know what they're talking about. I'm sorry. Because if we could get to 80%, we would really cut down transmission. Not to zero, but we'd cut it down. We just haven't reached it yet. And I don't know why they're spewing this nonsense. They're assuming they're assuming that vaccinated people can transmit, which had not been shown. Go ahead, Amy. I'm sorry.
That's okay. No, it was my fault. I don't understand. I see the Twiv cup. It's
Unfortunately, there's just water in it. It's not gin.
It's okay. You can pretend. What I want to know is 85% isn't that herd immunity for measles? For the measles vaccine? So the measles
90s.
So
I think measles is 90.
So let me get this straight. We could reach herd immunity for one of the most contagious, infectious, easily transmittable viruses out there, but we can't reach herd immunity for this wimpy thing? Okay, good.
Amy, you're expecting them to read.
Makes a lot of sense.
You're expecting them to go back into the literature.
No, right? I'm expecting better from Hotez. I don't really know who Fishman is, but Campbell I have no respect for, and he doesn't know anything. I'm just expecting better from Hotez, and at this point, he should have his Twitter account taken away from him. Totally with his phone. No, you should have a timeout of technology. I'll get back to you about when it comes back.
What's your take on immunity in people who have both had COVID and been vaccinated afterwards? So we don't have those data yet. But as Amy said, there's no reason.
Yeah, we do.
No, vaccine. No, yes, sorry, that's right.
COVID
yes.
Versus vaccine before vaccine, they're very well protected.
Yeah,
they
those
only
are the best.
One dose, and they're very well protected.
Yes, that's a really
And
good
there's
situation
many
to be in.
people,
Yeah.
yeah, there's many papers, and you've discussed several of them on Twiv, and I think didn't you and Theodora and Paul even discuss it?
Yes, we did.
So
Now, Paul thinks the third shot will do the same, but I'm not convinced. We'll see. We'll look at the data,
well,
right?
that's why he has Theodora. That's why he has Theodora. Theodora's job is to correct his uh, erroneous thinking.
Do SARS-CoV-2 variants have mutations coding for different amino acids that change protein conformation, or are they mainly silent? What do you mean by silent? So a silent mutation doesn't change the amino acid, okay? Some amino acid changes have less of an effect on protein function than others, but, the ones that have a biological consequence have amino acid changes that mediate, for example, in the spike, less binding of antibody. But they're also in other proteins. We have no idea what they do.
Well,
Is that correct?
that would mean we would do basic science. We don't do basic science here. We just focus in on one protein and solely one protein because that's all that matters. Luckily, I'm not really a member of this field.
Well, this is a good one. John Campbell uses the Southern Baptist approach. He would rather scare you to heaven than soothe you to hell. That's very good.
I don't know. I don't understand it. Maybe because I'm Jewish.
That's the Southern. I don't know. I'm not a Southern Baptist, but apparently they don't want to soothe you.
I don't know. Is that any different than being Roman Catholic, where you have to go do all the Hail Marys and go to confession?
I don't know. I'm out of the range now. I don't do that stuff.
Yeah, but you used to.
Well, when I was 5.
Up all the way till you went to college.
Well, didn't you go to the synagogue at some point?
You go twice a year. You go for Rosh Hashanah and you go for Yom Kippur, and then you call it a day.
Like you, we're vaccinated and continue to mask indoors even when not required. Since the virus is here to stay, what metrics will you both use to know when to stop masking? Many thanks. What will you use, Amy?
When cases are very low, you know, when they hit like probably when they hit like the flu level of cases. Rhino cases are too high, but probably when we hit the flu level of cases, I will consider it probably an RT of, well, I don't even know what RT means, but some number beneath 1 that doesn't allow for transmission.
RT is what you could calculate after the
but as far as
population's
I'm
immune.
Yeah, but as far as I'm concerned, it's just it's a meaningless number. It's a meaningless number. This whole idea that there's an intrinsic R naught to a virus, there's not. It's a meaningless number. It's a number that people have made up. There's nothing biological to it. And I know it's in the textbook, but it should be removed.
I just want to shout out Mr. Ozzycam, who's down in Australia. I've been corresponding with him since last year, and we've recently had a little discussion about transmissibility, and he thinks I'm mad at him, so I'm not mad at you. I'm just having a discussion, and I just want you to look at the data. That's all. That's all. Tornado in Scotch Plains. My phone was buzzing with the warning stuff, right? Go in your basement. Why not? We've had them before.
Really?
Yeah, we had one many years ago that drove big pieces of trees into the ground. I couldn't even pull them out afterwards.
In your house?
Yeah.
Oh, interesting.
Can weekly allergy shots manipulate the immune system which could make one more susceptible?
I don't know what a weekly allergy shot does.
I don't think they're so immunosuppressive.
I don't know what they do.
We didn't think much of Delta before it blew all variants out of the water. How do we know Mu, C12S, African, Lambda, etc. won't throw a wrench as Delta did? It definitely changed it all. What did it change, Rasha, exactly? And how do you know would not have been the same if it were the ancestral SARS-CoV-2? This is what bothers me, is that no one can really say that because that other one is gone. And if it were here, it might be doing the same things. So one of these might arise to be more fit than Delta, and it'll displace it. And then that'll be causing infections, and people will say it's more virulent and transmissible without the data for it. So, and as I remind you, as Ron Fouché said, this happens all the time with flu. Variants arise. They displace other variants. They're never called worrisome. They're never called more transmissible. We just make a new vaccine to deal with them. I don't want to do any more John Campbell bashing. So, hey, this is a good one. D614 Doug. Think of the thumb down as a non-binding antibody to today's epitope. That's really good. It's almost, Amy, it's almost as good as I'd rather listen to my ex-wife than Peter Hotez. Yes. I'm actually not saying that because I'm on a board with Peter Hotez, so I have to be nice to him.
Well, really? Because you're not nice to the other person on the board.
Well, he rubbed me the wrong way.
And Peter's not?
I don't talk to him, though. The other person I don't talk to.
Yeah, go ahead.
So that other person on the board told me he said, you shouldn't be criticizing vaccine efforts. And I said to him, who works for Big Pharma, I said, don't tell me about communicating as someone who has been secretive your whole career. And then he said to me, I feel I've had a very good career. And at that point, we stopped talking. Okay?
Well, being secretive and being productive are two very different things. So
of course they are.
I don't understand the relationship. So I don't really understand the comments because they're two very different things.
Anyway, we don't need to air our dirty laundry here. If a person gets vaccinated and then becomes pregnant, they still pass the antibodies to the fetus. Yes.
Yes. My friend did that.
You will. Yes, absolutely.
Actually, my friend was vaccinated during her pregnancy.
Now, here's a bit of misinformation. The graphs show mu already being vastly crowded out by Delta. Oh, sorry, mu. Yeah, Delta is pushing most variants out. In fact, if you look at, let's go back to Safari here. This is covariance. Nice site, covariance.org. So here's a list of the main variants and a few of the minor ones. And you see the most recent C12 is not even on the list because it hasn't really penetrated very much globally. We just have to keep an eye on it. But this is a nice site because you can click on any of these variants. So we could click on Delta, right? And then you go to another page where they explain all the changes. Look, all the defining mutations here. Spike, ORF1b, M, N, ORF3a, 7a. It's a really good site. I like it very much. Okay. Do you like that site, Amy?
It's fine. I don't have it. It's fine, but you have an attachment to it since the gall was, with somebody that you podcast with or know or something or other.
Is it too risky if a vaccinated person sees or dates an unvaxxed person? They're going to have close contact. What do you think, Amy?
Too risky compared to what?
That's just too risky in general. Is it too risky for the unvaccinated person? The vaccinated person is protected, right?
The vaccinated person is protected. Now, if the unvaccinated, it's no different than anything else that they do. So I don't know why. Yeah, it's no different than anything else that they do. If they go to work, if they teach in a school, if they go to a grocery store or whatever. It's no different.
Ronald, thank you for your contribution. Oh, your daughter's starting a master's at NYU. Great. Sometime when you visit, come to the incubator for sure. And then, after B&H, you'll drop a lot of money for sure. B&H is a block around the corner from the incubator. All right, Corey thinks we are making fun at people testing positive like Joe Rogan. We're not making fun. I'm not laughing. I'm just saying He said, I'm not getting vaccinated, and that's what happens, okay? Please don't ascribe emotions to us that you're not aware of.
Well, I'm not aware of
What?
that emotion. I'm not aware of it. I just think that somebody who had a platform that he knows he's able to manipulate people and have them think in the same lines doesn't recognize the danger of what he's saying, and that this is a way that maybe, unfortunately, this is a repercussion of that, and maybe somebody who has now been influenced by him will break out and break away and go get vaccinated and stuff. I mean, this is like the typical way you manipulate people, like starting with how people in Europe in the 30s were convinced to elect others, and how we've elected people that weren't good, and how kids follow some bully on the playground and various other things. And some kids are more popular than others. So I just think, I'm not laughing, but I do think that he is dangerous. And now maybe somebody will break out of his little thumb of influence and say, you know what, that was an eye-opening event. That's too dangerous for me. My whole family is not going to go get vaccinated.
He's taking ivermectin, by the way.
Well, there was a lot of stories in the Times about people who are taking veterinary levels of ivermectin having ivermectin poisoned.
Yeah.
So that's not a good plan.
I don't understand why he thinks there are long-term effects of the vaccine, yet he's willing to take ivermectin.
Because
I don't get it.
It is very clear. Ivermectin is a fully FDA-approved thing. Right. A vaccine was marketed as, you are not fully approved. We're doing this before we are fully approved. That's the difference.
But veterinary ivermectin is not approved for people. It's different dose, and as you saw...
But they don't recognize that.
Okay.
It's also under the FDA. They don't recognize that. Subtle difference.
All right, so Westfield 90, it's a little unfair, Amy. Even vaccinated can catch COVID. Westfield 90, what does it mean, catch COVID? You can get infected, yes. COVID is a disease, so... the disease you get is typically mild. So what's the point? Do you know the point here?
I don't know, but I don't know what I was unfair about.
Okay.
But thanks for pulling that one out.
I just wanted to know what you had said, and we could defend you. That's all.
Sure. We can go with that theory.
All right, so here's another one. 59% of patients hospitalized in Israel are fully vaccinated. I don't believe these data because they're different from what every other country in the world is finding. There's something chirping every few seconds.
Yes, the PCR machine is done. They should stop it.
Yes, so that's what the chirping is, Francois. Sorry. Oh, here's a good one. There's no such thing as herd immunity to corona, as Bill Hazeltine, another virologist who is ignoring basic immunology and virology.
And look at when he said it in early 2020. Really? It was unclear. Interesting.
Tomorrow I'm supposedly on David Pakman's show, yes. And I've been told I only have 15 minutes and I need to consider my answers accordingly. Which is like, yeah, okay. I'm not used to talking in short periods of time.
Well, I'm sure you could get to the point.
I have no worries about it. I have no worries. A lot of comments of ivermectin here. We are not going to get into that. Let's see.
All right, it's quarter to 9, like 3 more questions.
3 more. Okay. We got the Drosten.
I have to go finish setting up my ELISAs for the rest of the week. Otherwise, I will never finish my paper.
First question. Any word on molnupiravir? Seems to be taking quite a while. It's in a phase 3.
It actually failed.
It did?
actually failed. Yeah.
In the phase 3?
Yeah, it failed.
Where did you see that?
I saw it in Science. I think there was a full article about it.
Okay.
It was very disappointing. I think they have to go back and reconfigure.
Too bad. All right, number 2. I see docs researchers bring up prion disease and ADE as a risk of the vaccines. What does that mean?
So prion disease means that a protein that is abnormally formed will provide a seed for taking fully formed normal protein and making it also abnormally folded. But the vaccine that encodes spike, the spike is not abnormally folded, and spike is not a normal cell protein. So in order to have this process in your cells, it's a cell protein that then does the same thing to new molecules of that protein. But since this is not a cell protein encoded within your genome, it's not doing anything. An ADE, antibody-dependent enhancement, we've never seen.
Never seen it with the vaccine. So these are fabricated things that are meant to scare you and discourage you from being vaccinated. For what reason, I'm not sure.
But the thing that they're able to get away with it, is because 9/10 of the world doesn't know what prion disease is or ADE. And most people don't understand what prion disease is. And the fact is that it's never gene encoded, like genetically encoded, I believe. And it's.
So basically, they use these words that make people think they know what they're talking about, but they're not relevant. All right, that was number 2. I don't remember. We'll do one more. I was mRNA vaccinated in April, exposed to COVID in August, never got sick, never tested positive. Did that boost my immunity, although I didn't test positive? Probably not. Right, Amy?
I don't know if I could say that, because I don't know when you were tested in relationship to when you were exposed.
Yeah, it's true.
So I don't know that I can say anything about whether or not there was an immune boost or not. Sorry.
And finally, where can we find a simple explanation of how T cells work in a way that a 5-year-old could understand?
Isn't that in Susanna's book?
Yeah, I think so. Debs, if you go to my blog, virology.ws, I posted a few weeks ago an illustrated book for kids by a bunch of scientists in Mexico, and that's their 3rd book, and I think they do go into immunity and T cells and so forth in that one. So there's a link to all of them. Just go through it, and you could search for Virology blog Susanna Lopez, or just scroll through. You'll find them. Thank you, Amy.
For what?
For suggesting that, because that's perfect. That's perfect.
Yeah. Sorry.
All right, one more?
I think my brain is blowing away. The wind is really,
Okay. One of my professors mentions he saw some data that indicated the SARS-CoV-2 genome can integrate into human DNA. Is there a paper on that? Unfortunately, there is.
Oh, my God. Seriously? See, this is the problem. He's a National Academy member. He's a hack. He should never be playing with virus. And look at what he's caused.
Yes, so there was a paper, but it's done in Cells and Culture. And another paper has just come out. You probably saw it, Amy, which said that they find no evidence of integration. 5
papers. And the word artifact, I believe, is in 4 of them, in either the title or the abstract. This paper from PNAS the senior author should take it upon himself and retract it.
Yeah, I agree. Here's another one for you. What's the risk of seeing effects similar to vaccine attributable to severe dengue in Thailand? That's antibody-dependent enhancement. I don't as Amy has said before tonight, we don't see any risk. There's no evidence of ADE, which is what you see with dengue, with coronavirus at all. So I don't know why it persists on being discussed. There's zero evidence for it. Why would antibodies work in lung epithelial cells given there are two pathways for entry, which is why ivermectin is ineffective? Well, it's why hydroxychloroquine is ineffective, but antibodies block the binding to the receptor. So all entry pathways require the receptor ACE2. So that's why antibodies work everywhere. Am I on point, Amy?
Yeah, I mean, there's two ways. So you can either enter directly at the cell membrane or you go through the endocytic pathway, right? And all of them are mediated by ACE2. So.
Yep. Excuse the diversion. Can you play Champagne Supernova by Oasis on that guitar? It would be good if you could sing it like Lee McGallagher. Amy would love it. Unlikely, right, Amy?
I would love it. I wasn't a big Oasis fan when I was a kid. So, I mean, if you can play it, I'll be thrilled. But I wasn't a big Oasis fan.
Some of the UK SAGE members are saying herd immunity will be impossible because vaccinated people can transmit. That's the problem. There's no evidence, in my opinion, that vaccinated people transmit. That is the problem. And they're making a big leap, and I think that's not right.
Oh, why focus on the details? All right, 2 more, and then I have to go. I have to set my ELISAs for tomorrow. And I have a lot of plates.
Why do children not produce anti-nuclear capsid antibody, Amy?
I choose to take the 5th, considering the fact that the woman who published that crap sits next to us.
Yeah, I think that's incorrect. It makes zero sense.
Yeah, it's biologically not possible. It's the most abundant protein in an infected cell. It's not possible. But as I said, I take the 5th because the lady sits next to us.
All right, one more for Amy. Early in the pandemic, some estimated that there were 2 to 4 times more cases than being found via testing. Do you think it is similar now?
I think that was an underestimation at the beginning, and it's an underestimation now, yes.
One more.
All right.
Do you agree that everyone vaccinated and unvaccinated will be getting COVID?
No.
Nope. I don't know what John is thinking.
Well, with somebody advocating that, then there's no point in the vaccine. There is no point in developing a vaccine. There's no point in getting a vaccine. There's no point for any vaccine ever in this world. And I don't know that we want to say that. That doesn't seem to be scientifically sound to me.
Yeah, and here's the other point. The myth statement about herd immunity is coming from a professor of virology at Oxford. Completely irresponsible, based on hardly any data.
It says irresponsible as the Israelis saying that their boosters are protecting against infection. And as I said to you and Daniel, what did I say in my text to you and Daniel when I sent this horrific article? That it was completely irresponsible.
You wrote...
I wrote, I believe, this conclusion is completely and utterly irresponsible and dangerous. Wasn't this spin already done? Couldn't they think of something else more creative, like telling the truth?
Amy, thank you for your insight tonight.
My pleasure. Please don't forget the liquid nitrogen.
Of course not. I will see you in the morning.
Yeah, it freaks me out when it gets too warm.
I'll be there.
I worry about my cells.
We'll be
there. I don't
have
any money. I need more money to do research, so people should be giving me money.
Thank you, Amy. Good night.
All right. Good night.
All right. Hello, Andrew. Kiora. So Ian Fraser told me how to pronounce Kiora. It's kind of blended together. The new scary is Mu. Yeah, it's Mu. Yeah, one after another. You know what? Why is it that every year influenza variants arise, but they don't scare anyone? Because we're used to them? No, because certain people amplify it for the COVID pandemic, and it goes through the press, and the press believe them. People who should know better. Professor of virology saying herd immunity is a myth. It's the most absurd thing I've ever heard. The color of your glasses fit the spikes on your polio model. Let's see if that's correct. Yeah, it's close. It's a good thing Amy isn't here. She would say, "Put it down." I have to focus this. Let's get this right. There we go. Yeah, put it down. Isn't it beautiful? It's poliovirus with its receptor. Let me get Zoltan off here so we can see the poliovirus PVR. Oh, this is so gorgeous. This is going to the incubator for sure. This is going to be behind me. So I have to set up the incubator so that I have behind me all these virus models on a stand. You know, that one is a glass model by Luke Jerem, who does glass viruses. Amazing. My colleagues gave it to me for TWIV 600. But tomorrow we're having TWIV 800. I don't want any more gifts till 1,000. By the way, when we hit 1,000, we're going to do it at the incubator, and we'll have room for maybe 20 people to see it in person. Thank you, Westfield 90, for your contribution. 22,000 views on the Lex video. Is that right? Let's see. Let me see here. 19,000 views, yeah. And that was a while ago. It does better than my work does. Go figure. I go on someone else's podcast. Well, of course, I know that Lex Friedman is he's got a broad interest in many things, and people like that. Whereas me, I'm a virologist. So as Alan Dove would say, we have a niche audience. I haven't heard from Louis Rossman. What's going to happen with that? Yeah, UK public health docs did tell the country herd immunity is no longer possible. I just don't see the data supporting that, okay? That's just wrong to say that. And you know why they're saying it? Because they want to get some attention. I'm sorry to tell you. They're not thinking clearly. And I'm not trying to get attention because I don't get any, folks. I get very little compared to John Campbell. An order of magnitude less. All right, Michael, given I'm fully vaccinated, have no children, and hospitals in my country are operating normally, is there any reason for me to avoid coming in contact with the virus? I would say a good reason, Michael, is you're fully vaccinated, but you could get a mild to moderate COVID, right? Like a bad cold. People who are not vaccinated and get that kind of disease, kind of COVID, let's say, some of them go on to get long COVID. And we don't know how long that lasts, but that's not a good thing, right? Because it could last for years. So I would say you want to avoid getting any kind of COVID. That's what Daniel Griffin always says. I don't want any kind of COVID because we don't know the long-term consequences. Until we do, just watch out. Okay, Michael? That's what I think. Do we know if COVID is primarily transmitted by aerosol or droplet? I don't think we actually know. There are people who are big aerosol. So aerosol is what people use to mean the tiniest droplets that go long distances. You know, measles is mainly transmitted by aerosol. So I could be lecturing a class, and all the way in the back, if I had measles, they could get infected in the back row. So I think it's more likely that most of the infections are happening by droplets, because I think the small droplets are too tiny for this virus to initiate an infection, except in circumstances where there's a person making a lot of virus, and I think those are rare. But that's pure speculation. I admit it. And I don't see the epidemiology that would say you can get such long-distance infection consistently, folks, there are always anecdotal explanations. We don't care about the exceptions. We want to know what the rules are. So that's what I think. When immunity is partial, 75%, it would not achieve a goal of eliminating. In that sense, herd immunity is a myth. No, it's not true. You have to think of it in terms of transmission, U.S., not infection. Infection doesn't matter if you don't transmit, right? I see no evidence that, or let's say, it seems that vaccinated people are transmitting far less efficiently than non-vaccinated people. That is how you get herd immunity. It doesn't have to be infection or no infection. Absolutely not. We get herd immunity with many viruses for which the vaccines are not blocking infection. So please don't say that it's a myth because of that, because that's wrong. Isn't herd immunity a myth if only half of the country gets vaccinated? Well, it's not a myth in the sense that the concept is a myth. I don't know why you folks are using this word myth just because people have said it. You can't achieve it if only half of the country becomes vaccinated. Right. But it's not a myth. No, it's biologically correct. Ay, ay, ay. What a world. Okay, can you clarify? Oh, what a cute owl. Can you clarify that the mRNA and vector vaccines for COVID do not have adjuvants? No, you need an adjuvant when you give people a bolus of inactivated virus, say, or virus-like particles. You give a lot of protein and you want it to go longer, so you give an adjuvant to make a better immune response. An mRNA vaccine, you're not giving them a bolus of protein. There's no need to put an adjuvant in with it because the cell takes up the particle and makes the protein. So an adjuvant is of no use. Same thing with a vectored vaccine. The vector is delivering the gene, the DNA, to cells. The cells make mRNA and they make protein. No purpose for an adjuvant in those conditions. So the inactivated vaccines for COVID, some of them are adjuvanted. So aluminum hydroxide or some other kind of adjuvant is added to stimulate innate immunity, which gives you a better inflammatory response and gives you better antibody and T-cell responses. Is it me or just the T-cell aspect is getting more mainstream attention? Yeah, I think there's a little more attention, which is like 6 months after it was first brought up by Alessandro Sette on TWIV. First of all, I think some people watch TWIV and think maybe we should cover this. It's fine, but still mistakes are made. Immunity given by vaccines is waning. As dumb a statement as you can make because it's irrelevant. I don't mean to say dumb because I think people make mistakes all the time, and I would never call any of my students dumb, so I take that back. It's not a good statement to make because you have to be specific. Still immune so far anyway. I've heard those inoculated with bird flu were immune to SARS-CoV-2. That's intriguing. I don't know about that. I think that's highly unlikely since there's no cross-reactivity. Yeah, this is the thing that Amy was complaining about before Israeli Day. So 4 times protection with the third shot. Really? Well, that's not news. It's not even a finding because it's totally expected. Yes, you're going to get a boost in antibody levels, and it will protect against infection for a couple of months. But by 6 months, the antibody levels will go back down as they did after the second shot that you got 6 or 8 months ago. So what is the point? The only point is if you have now broadened the antibody response so it covers more variants. But even then, I would say, why does it matter if the vaccines are still preventing serious disease and death, which they are already without a boost? I think natural immunity should count as much as proof of vaccination. Is there a way to prove you have immunity? So this is an interesting discussion. If people have recovered from infection, shouldn't they be considered vaccinated? So the reason they're not is because they would have to test you, and we don't know what level of antibody correlates with protection, frankly. That's the problem. So if you have X number, if you get an antibody test and your number is X, we don't know what that means because we don't know what the correlative protection is. Now, listen to the next TWIV, Dropping at Midnight, where we discuss a modeling study where they tried to estimate the correlative protection for antibodies. And they admit it's very imprecise. Someday it won't be, and it could be used to guide things like this, where you say, oh, I've been infected, here's my antibody level. Oh, good, you're protected, you're vaccinated. So we're not there yet, Debs. That's the problem. Hope that's clear. Thank you, Wild Bunny. Are the UK Euro plans to drop general testing and achieve herd immunity in kids naturally wise? No vaccines under 16. No, it's not wise because, as Daniel Griffin pointed out last week, infections in younger kids are increasing in the U.S. weekly, and more kids are being hospitalized. So you tell me if that's a wise decision to do something that results in more kids going in the hospital and more kids potentially getting long COVID. Isn't it the job of public health agencies to protect people? Doesn't make sense to me. Do you think the YouTube docs dude from Hopkins who said the pandemic was going to be over last April because of herd immunity at 50% vaxxed caused people to let their guard down, give them an excuse to not get vaxxed? It's not a bad idea, I think. I don't know if that's true, but I think there are many reasons why people decide not to get vaccinated, and that may be one of them, yeah. What are your thoughts about the transmission study Daniel covered the other day, suggesting people who become symptomatic at some point transmit? If you recall the discussion, Daniel wasn't so keen on that conclusion. I'm not sure that the numbers are good enough to say that. I'm all for investigating all this. What I'm not for is drawing conclusions when we don't have the data yet. But, unfortunately, in a fast-moving pandemic, that's what happens. Preprint comes out, the press wants to know, what does this mean? Someone says what they think it means, and then it goes throughout the world. That's the way it works, right? Have you heard about 2 FDA officials resigning since they believe the administration's push for boosters is political, not data-based? I haven't heard that, but I don't know why they're pushing for boosters. I mean, the science just doesn't say it. And a lot of people agree with that. Not everyone thinks we need boosters, so I'm not sure why we're pushing it. It could be political. Why not? I accused the previous administration of being political with public health. Why not? If it's warranted. Recombinant receptor binding domain for peptide immunization. I think RBD alone, it's an interesting idea because there is a cryptic domain, there's a cryptic epitope in the RBD that's not well exposed when it's part of spike. So, and that epitope is broadly neutralizing when antibodies are made against it. So in that paper that described those results, which we talked about a couple of weeks ago on TWIV, the authors suggested maybe immunizing with RBD might be an interesting way to get those antibodies specifically. So on the one hand, it's an interesting idea, but on the other hand, I worry that we're really focusing antibodies on one part and nothing else. And I think spike alone is not a good idea. I think we need more viral proteins. If scientists like you could vote for who's running the CDC and FDA, who do you think would win? I don't know who specifically, but here's the thing. People who have been running these agencies lately, well, FDA, the best FDA commissioner, in my opinion, in recent years, was the guy under Reagan, I can't even remember his name, who went under multiple presidents. He was an MD. He was very familiar with drug regulation. The CDC director should be a public health official. But there are recently MDs who are not public health specialists. And Lori Garrett said that on Twitter, and I have to agree with her. So I'd try and find a public health person, not a medical doctor who's an administrator. Because I understand maybe you need an administrator to run the CDC, but they're not really running it. They're the public face of it. And I think you need a public health person who understands the data and can make the right decisions. Did you see the media saying antibody tests can't confirm if you're protected? Okay, so it's kind of the wrong way to put it, but what they're saying, what they should be saying is that we don't know what antibody level correlates with protection. Okay? That's the problem, and I just talked about this a few minutes ago. Let's give a number. Let's see if you have 100 antibody level. We don't know if it protects you. If you have 50, we don't know if it protects you. We have to figure it out. That's called the correlative protection. And you also have to define what you mean protected against, right? Are you protected against any COVID, asymptomatic, mild, moderate, severe, etc.? And so that's not been done. And so maybe that's what they heard, but they misinterpreted it. You certainly have been infected. You certainly have some kind of immune response. You're probably protected, but we don't know what level correlates with protection. What about flu this winter? So I was asked this on the AMA. So the Reddit AMA, right? There's a coronavirus subreddit. I've done a couple so far, and I'm trying to do them every Wednesday at some time Eastern. Today I did it at 11 a.m. Probably next week I'll do it at noon. But I announce it the same day, unfortunately. I'll try and I can't announce it any other time. Yeah. In the UK, they're saying herd immunity is a myth. So back on herd immunity is a myth. They're saying everyone will get COVID. I don't know why you would say that. I just don't know why you would say it. I mean, it's probably not a bad thing eventually, but because, vaccinated people, if they get infected, then technically they have COVID, right? Even though they may have no disease whatsoever. I think that's a goal in a sense because, almost everyone has been infected with the common cold coronaviruses. Now, someone said earlier that there's no herd immunity to common cold coronas. Well, it depends on how you define herd immunity. If you define it against severe disease, then sure as hell there is herd immunity to common cold coronaviruses. There's not herd immunity to protect you from getting infected. There's herd immunity to protecting you against getting severe disease. The common cold coronas cause mild colds that people are okay with. So I would say that's a herd immunity success. As always, folks, you can't be oversimplified when you talk about this. There's a lot of nuance that the press doesn't get, and a lot of people don't get who should know better. And I'm not just standing on a soapbox. Folks, I've been thinking about this for 40 years. It's not, as Amy would say, it's not rocket science. Did you agree or disagree with Lex's take on Dr. Fauci? Honestly, I don't remember. But we did talk about him, and I agreed that he had made some mistakes. And I think I discussed that it would have been nice if when he made a mistake and changed his mind, he would say, I made a mistake. Because I know from personal experience that if you admit you made a mistake, you were wrong, that people really appreciate that. And it goes a long way to restoring your credibility as opposed to not admitting you made a mistake and just moving on. I wish you would do that. But as someone told me, we had another discussion. I was on a podcast Monday night, Mythbusters, including one of our listeners here. Where they said, certain public-facing people can't admit they're wrong. So it rules me out for public office, I guess, of any kind. But I don't want it anyway. I just want to do this. Thank you, Ronnie, for your contribution, for all the free education. Every Columbia Virology course lecture since 2015. And every Twevo immune twin TWIP since 2016 OU, big time. Well, thank you, Ronnie. Just saying it is good enough for me. Really, I love doing it. I love teaching. Yeah, so with the resignations, I did peripherally hear about it, but I don't really know much. Sorry, I have to look into it. Or if Amy were here, she would know. Jack, even you get reinfected and people get reinfected at different times, would herd immunity only be temporary? Look, we're defining herd immunity against severe disease. That's fine. Polio vaccines allow transmission, but people don't get paralyzed. That's herd immunity against disease. It's not part of the definition of herd immunity. If people think it's not, then they just don't know. They haven't looked at it closely enough. Hi, I'm not vaccinated, got over COVID, no symptoms, stuffy nose, scratchy throat. I'm going to get the vax. Do I need it? It's a great idea to get vaccinated because then you will have better antibody immunity than most other people. You will be able to deal with any variant that we have or that probably will arise in the future. So that's why you ought to get at least just one shot is all you need after recovering. I think you have terrific immunity. However, as we said earlier, if you didn't get vaccinated, immunity is uneven after infection. Some people get really strong immunity, others don't. And so we wouldn't know where you fall. So just to assure that you're protected, get a shot. Interesting point. If a vaccinated person gets infected, there's a shorter active infection, longer time for scrap RNA leading to false positives. Should PCR be recalibrated for vaccinated people with new CT values? Well, I don't know if you could make a correlation between CT because you got a lot of crap RNA, and it's not clear that even if you had more RNA, you would be infectious. I think that we need to first look at more people in a more detailed way, vaccinated versus unvaccinated, and shedding. The Singapore study was good, but we need more of that. And then get an estimate of infectious virus shedding, which is never done. It's really hard to do. To just get an idea of how much infectivity is there. And, right now, if you're positive, you have to be quarantined in certain situations, and that may not even be necessary if you're not shedding any infectious virus. So I agree something has to be done. It's a really good point. I'm not sure it's just about recalibrating the cycle threshold. Okay, I know how you feel about boosters. Yeah, it's hard to escape hearing what I feel about them. And it's what I feel. It's what Amy feels. And we tell you why we feel that way, okay? If you got the Russian or Chinese vaccines, would you suggest they get a booster here? So I think the Sputniks are pretty good in terms of protection against severe disease. We saw those data. They look good. The inactivated vaccine from China is less effective. So that would be one where, yes. And but also some countries require they don't recognize those as FDA approved or authorized, and you have to get it anyway. But I think it might be a good idea with certain vaccines. You have to look at the data and decide for yourself, but I would do that if it were me. Can the RNA itself or fragments of it stimulate? Yes. So RNA can be an adjuvant in the sense that it can stimulate innate immune responses. And we don't know what the contribution of that is to the immunity produced by mRNA vaccines. Right? It would be hard to do because if you take the RNA out, there's nothing left to make an immune response. That's the assumption because we know there are sensors for RNA in cells, and they trigger innate immunity, which is good for adaptive immunity. So in theory, yeah, but we don't know for sure. Now, someone is accusing me of being a campaigner for Big Pharma. Nothing could be further from the truth. You're just not thinking clearly. I'm a campaigner for data, scientific data. I work for a university. I don't work for Big Pharma. I don't get paid by Big Pharma. I don't get any money from them. So what are you talking about? Yeah, if I were working for them and got a lot of money, sure. If I were the CEO of Pfizer, sure, I'd tell everybody to get boosters. Gosh, you got to be nuts to think that they wouldn't do that. All right, so you had COVID in March, had your T cells tested. Result was positive. You tested last week. They were negative. They didn't go away. I think the test is not sensitive enough, and you've definitely got memory T cells there. Of course, depending on the severity of your COVID, that could make a difference as well. Was it mild? If it were mild, maybe the memory levels are much lower, and you can't detect them. So you may not have any more circulating effector cells, but you may have memory cells that are going to be activated if you got infected against. As a fully vaccinated person, I no longer fear the infection itself, but I do fear the need to quarantine if it happens when away from home. Well, I guess you don't know if you're transmitting. That's what you're worried about, right? It's fine. I can't argue with you. I just don't think there's any evidence for it. But if you want it to be safe, that's reasonable. Someone said the mRNA is like a wanted poster, telling the immune system this is a bad guy. If you see him, get rid of him. Is that a good analogy? Well, the thing is, it's not the mRNA that's doing that. It's the protein encoded by it. But, okay, it's an all right analogy. There's got to be a better one, but I don't have it right with me now. Not a terribly clever guy. That's the story on a more universal, working on it. It's going to take time. Hopefully, the experience of this pandemic will make research on it go quicker. And when the pandemic ends, it will not stop, right? But it can be done. Just like for flu vaccines, people are working on universal vaccines so we don't have to get one every year, right? If you get monoclonals, do you also develop natural immunity? It depends on how early you get them. If you get them early enough, I think in most cases when you test positive, you're already at very high levels of viral antigens being produced. So you're going to make some kind of immune response even with monoclonals. And certainly if you get them late, like when you go to the hospital, you're going to certainly have made an immune response for sure. What is common profiles of people who get serious reactions to COVID vaccines like thrombosis? Not clear. It's a good question. People are working on it. But, it's rather rare, so it's not going to be easy to tease out. I've read a few places that some experts are expecting this flu season to be really bad. Why? Well, we've had a year of pretty mild flu, right? So a lot of people are not immune. They haven't had immune boosting as they would normally every year. So that's one idea, that we're going to have more immunosusceptible population, and that's going to drive a higher number of cases. I don't know if that's true, but it makes sense to me. I continue to see terms like live virus, no live virus, killed virus, shedding live virus, if virions viruses are not living things. Well, that's because some people think they are living, and others don't care about the terminology. It's ensconced. Whereas I've thought about it a lot. I've come up with an idea about what constitutes something living, and viruses don't fit it. Virus-infected cells are alive, but the virus particles are not. So you can't talk about a live virus vaccine. I talk about replication-competent vaccines. But most people don't care, and if you call them out, they'll start to argue, yeah, I think viruses are living, and then what are you going to do? Have an argument for an hour? It's not worth it. So I let them do what they want. I try to use the right terminology. Hello, H-Zoo. My teenage daughter asked me if there were ever two respiratory pathogens in a pandemic-endemic at the same time. Well, an endemic is any virus that's present in a population, right? So lots of viruses are endemic in humans right now. right? HIV is endemic in humans, and we have an HIV pandemic and a COVID pandemic going on at the same time. So yes, for sure. I mean, this is unusual. We have 2 pandemics, but there are plenty of pandemic endemic scenarios as well. How would a fully vaxxed person who has not had COVID get their T cells checked? Well, there is a T cell test, but it's not very good. It just tells you whether you have virus-specific T cells or not. So there's not a good test right now, unfortunately. And that's why we mainly use antibody tests, because they're easy to do, and therefore they can be clinically useful, right? If there's not a good T cell test, then clinically that's not useful to track correlates of protection. Okay, Ozzy Cam, I have seen your recent emails. I'll get to it. I'm not mad at you. I'm just trying to steer you thinking correctly about viruses and transmission. No worries. Thank you for your contribution, Mr. Ozzy Cam. Not mad at you at all. Just because I argue or disagree doesn't mean I'm mad at you. And just because I get a certain tone doesn't mean I'm mad at you. I'm just very passionate about science, virology in particular, and I very much dislike it when people make the wrong conclusions using misinterpretation of the science or absence of science. And you've probably seen that if you've been on these live streams for a while. Thank you for your contribution. You've mentioned that HPV vaccine protects against infection. Other vaccines do not. Why? I don't believe we know why. One of the reasons is likely that mucosal immunity against HPV remains high. So if you have antibodies in your mucosal surfaces, especially the urogenital area where the HPVs infect you, that's going to stop infection. But for most mucosal pathogens, the mucosal antibodies decline very rapidly after vaccination. They don't seem to for HPV, and therefore they block infection. But why that is, we don't know. It's a really good vaccine. Does the recent Israeli study comparing naturally acquired immunity versus vaccine mean group 1 shouldn't be required to get vaccinated? It was a small study, and as I just mentioned, there are going to be many people who were infected and recovered that really don't have adequate protective immunity for whatever reason, and we want them to be protected. So they should get 1 shot, and then they're better protected than anybody else on the planet. And that's very impressive. If you don't like that, then take your chances. But I don't think those data should be interpreted to mean that at all. And by the way, live virus, people who use the term live virus, it just means infectious, which is the term I use, infectious virus. And if you want to talk about inactivated virus, that's fine. I don't talk about killing virus. Thank you, H2, for your contribution. Really appreciate it. I think the monoclonal antibodies I answered. Does Typo blood have a protective effect? No. It was thought early on that it did, but on more careful study, it turned out it did not. Am I excited to be on the David Pakman show? I'm sure. I don't know much about the David Pakman show. Should I be excited? I'm happy to be on any show of anyone that wants me, for sure. So, yeah, it's cool. 11 a.m. Eastern. Okay, paper from Madison County, unvaccinated, vaccinated CT values. Any further comments? The Singapore study is the best. They did a time course of PCR. The people with vaccination, the PCR RNA viral load drops very quickly compared to unvaccinated people. So that single time point, which is what they did in the Wisconsin study, is just misleading. And there was another study out of the Netherlands, preprint. We didn't do it on TWIV because I'm trying to stay away from preprints. I want to get the final work. Says that the samples from vaccinated people are less likely to be infectious in cell culture in the lab. So I think the end point is we don't have the data yet, And the whole idea that vaccinated people are shedding is just not substantiated at all and should not be driving public health policy. That's just where I'm coming from, looking at these data. We're not there yet. It may be that it turns out they are shedding, in which case I will tell you, but I don't see it right now. Do you think there's enough resistance in the advisory committee to vote against general boosters? I don't know. I only know Paul Offit. He's publicly stated we don't need him. And he emailed me after I wrote my blog post. Did you read it a couple weeks ago, virology.ws, where I said these are the reasons why we don't need boosters? He emailed me and he said, I totally agree with you, Vincent. I mean, that's just a wonderful compliment. So I don't know about the other people. Paul's the only one that I communicate with. What's wrong with the word breakthrough infection, meaning infection among the vaccinated? Breakthrough, to me, implies that it's something wrong. It's something that shouldn't be happening, right? It's breaking through. No. As I said, very few human vaccines actually prevent infection once you're 6 to 8 months out after the last vaccine. So it's not a breakthrough. It's just an infection. Somebody used that bloody term early on, and it's stuck, and we can't get rid of it. That's why it's not a breakthrough. It's just an infection. Ay, ay, ay. Would a booster keep more people from spreading it for 6 months? Because we know after the second dose, you had high protection against infection, but it goes down because your antibody levels decline. That's a natural process. They do for all vaccines. It's nothing special with this one. So you boost, the antibody levels are going to go back up. You're going to be protected against infection for 6 months, and then it's going to go down. So what are we going to do? Boost every 6 to 8 months? That is not a public health strategy, folks. I don't think so. I mean, we do that for flu every year because the virus changes, but just to maintain immunity, which we don't do for any other vaccine, the solution is to get more people vaccinated or infected, at which point then there will be less serious disease, and we won't worry about it. Oh, Rogan got monoclonals? Okay. I don't know how old he is, but if he's 60 or over, he could get them. If he's a celebrity, he could get them, or a politician, right? I could ask, if I hadn't been vaccinated and I got severe COVID, I could ask Daniel to get them. But, yeah, depends who you are. It's not an equal world, folks. You know that. You know that. The booster explanation has been hugely important. Thank you. Really appreciate it. No, I didn't see them. I will have to have a look. I do miss some things because I'm reading all the time. I can't cover everything. I'd love to. Yeah, The Guardian is the source of the myth, but Pollard is wrong. He's flat out wrong because it's not true that the vaccines are not stopping the spread. They are allowing infection of vaccinated people, but he's conflating that with transmission. And he thinks that just because you have a high viral RNA load that you must be shedding infectious virus. I'm so sorry that he's wrong, but that's wrong. If they had asked me, I would have set him straight, but they don't ask me. Some people do, but what I say doesn't propagate. Okay. Thank you, Elise, for your contribution. Such a dreadful mistake that breakthrough weren't defined up front as severe disease. So that's okay. So if a fully vaccinated person gets severe disease, gets hospitalized, which happens, right? It's not 100%. Then it could be a breakthrough disease or something like that, but not just infection. No. Talk a bit about how degraded mRNA is detected. Well, mRNAs have signals in them that determine how long they last in the cell. There's a whole machinery of RNA degradation in the cell, enzymes that see that signal and chop up the RNA accordingly into nucleotides that then get recycled. That's basically it. So these mRNA vaccines do not last very long in the cell. So this is what my point. The neuroradiologist as a COVID advisor is simply wrong. You need to have an internist at least, right? And someone who is specialized in internal medicine, not a radiologist, not a cardiologist. And of course, if you're lucky, you get an infectious disease specialist. More ADE, potential concern for vaccines. So the reason it's a hypothetical concern is that if you have antibodies that bind, say, the spike and don't neutralize it, they could lead to uptake into cells that are not normally infected and cause a worse infected. And so it's theoretically possible, but there's zero evidence for it in the past or currently. So I don't know why it's an issue. Is that an excuse not to be vaccinated because it could theoretically lead to ADE, which has not yet been seen? I think that's crazy. Makes zero sense. I like this one. Newspaper practice, if it bleeds, it leads. That's really good. I think we have our highest number ever, 774. That's pretty cool. I hear people are worried about waning immunity because more vaccinated people are starting to be hospitalized. Yeah, because more people are being vaccinated, right? And, you know, the threshold for hospitalization really differs for many people. So I don't think that's a good metric. I think severe disease and death is the metric. What reassures us that COVID immunity won't wane like it does for flu? In other words, won't wane and allow severe disease to occur? There's no reassurance. I'm just saying the waning of immunity is only for neutralizing antibody levels. It does not wane for preventing severe disease. Sure, it could. It could wane, and more people might die who are vaccinated. But we're not there. And until then, of course, we should be ready, but we're not there. And there's no point in saying we need a booster now when we're not there. It could be years before we're there, or at least a year. My unvaccinated 20-year-old niece got COVID, fully recovered in a week, mild infection. Now she wants to take the vax. How long should she wait? I would say 4 weeks. What do you think about Mu? Well, as any variant emerges, it is more resistant, more virulent, more transmissible. Any more word you can think of, it will be ascribed to it, which is the press cranking it out so people will purchase their product or whatever it is that they survive on. I think the future looks great. I'm sure it's as inhibited in terms of severe disease and death as are all the other variants so far. You guys are the reason I changed my mind. Thank you. I don't know which way you went. I hope it was positive. I don't want to change it in an opposite way. Do you think we should just test people unless they have symptoms? No, if you have certain populations that are not vaccinated, you should test them frequently. So schools this fall, the best mitigation would be frequent testing, because then if someone's positive, you keep them home until they're negative, and that really cuts down on outbreaks. Testing is still a great way to limit outbreaks. We don't do it enough anywhere. $9.40. How should we go to 10? Okay, we can go to 10. You know, I'm not even halfway through your questions. I can't tell you how badly that makes me feel every week that I can't get through all your questions. I got through them all on Reddit today. That makes you feel good, right? Oh, I don't have a beef with Bill Nye. That's not the guy with the bow tie. That's Peter Hotez. He's scaring people. I don't think that's appropriate. You want a Zoom background of Amy's lab? I could take it for you. Send me an email, vincent@microbe.tv. I'll just go in there and snap it. Daniel has a bow tie. I have no problem with Daniel. You know what? Daniel says something, and I say, but wait. And he says, yeah, you're right. He gets it. He's very reasonable. Waning immunity, misunderstanding of immune response. Prior exposure trains the immune system to respond rapidly on future exposure. Absolutely. We have memory that responds quickly instead of taking weeks to make antibodies and T cells. So it doesn't matter what the levels of antibodies and T cells now, because you have memory B cells, you have memory T cells that can respond quickly. They won't prevent infection for the most part. They will prevent severe disease. This is how vaccines have always worked. I don't understand why it's been forgotten in this pandemic. I don't get it, folks. There's no second non-ACE2 viral entry pathways. It's all ACE2 mediated, and antibodies block the ACE2 interaction. Let's see. Lots of discussion. Oh, what's your guess of the percentage of the U.S. that will get the third jab? So let's say we got 50% of the U.S. has gotten 2. I think maybe we're lucky if we get half of them to get the third. I think just it's a failed public health approach because you forced people to get 2 jabs. They obediently went and did it. It was not trivial. Now you want them to go back for a third? I think you ought to think it through before you do that. Doesn't make sense to me. Thank you so much for your contribution, Nifty 50s. Info on long COVID in kids. The info is very sparse. Of course, it's much rarer than in adults because the infections are rarer, but kids get long COVID. We don't know how long it lasts. Itchy rash for 9 months, sure, that's a long COVID, but it could go away. See, it's just too early. We do not have enough information on that. That's why Daniel's updates are so good, because he keeps track of that. Antibodies, what was it? Antibodies wane, but T cells reign. That's going to be the T-shirt. Yep. Why do only 1 in 100 people have a severe reaction to polio, and does COVID follow the same dynamics? So 1 out of 100 infected people will get paralysis. Polio-infected people will get paralysis. But, severe COVID is 20%, so it's not the same dynamics at all. And I think the mechanisms are totally different. I think, so polio virus reproduces really efficiently in your intestines. It's shed in the feces, and it transmits really well. And most people are fine. So the invasion of the CNS is an accident. Virus has, there's no evolutionary purpose for the virus to go there because it's a dead end. It doesn't contribute to transmission. So it's an accident. But accidents do happen when viruses are coursing through your blood. How long will kids be needing masks? As long as the kids are mostly not vaccinated. But once if it's true that at the end of this year we can start vaccinating under 12, then probably in the spring we should be able to have everyone unvaccinated. We'll have a lot more infections. We'll have a lot of more people vaccinated, not everyone. So I'm thinking next spring, but I'll probably be wrong because I said fall because I thought more people would be vaccinated. So Amy is still in the lab, although someone said check the weather. Amy has just 5-6 blocks to walk. And hopefully it's not flooded in the streets of New York. But boy, before I came down here, it was raining like crazy. If they stopped quarantining people with severe polio because most people infected were asymptomatic, why did we quarantine everyone for COVID? Well, as opposed to, so we quarantined people initially who were positive, right? No matter their CT value, because they're transmitting. For polio, many people transmit, but we can't identify them because in those days we didn't have PCR. The only way we could tell if someone had polio was by the paralysis. And we learned that, later on by serological surveys that only 1 in 100 people got paralysis. So in hindsight, we learned that quarantining the paralyzed people was useless. But now we can do PCR, identify PCR positive people, and the assumption is they're shedding, although that's not even true because only 20% of infected people actually transmit. 80% of infections are transmitted by 20% of the people. So there, as we discussed earlier, there's still a faultiness to the PCR mechanism of identifying infections. And we have to figure out a better way to say who's shedding infectious virus, because PCR isn't it. What N word? What is the N word? I forgot. I can't neutralize. It's not neutralizing. It's not nuclear protein. I forgot, folks. I'm sorry. It has something to do with science. Sorry. Yeah, herd immunity is the subject for tonight. Let me go through here and find some super chats. What if places start requiring booster? If it's required, get your booster. There's no downside. I just think there's no reason to do it. I think the public health decision is ill-advised, but they don't ask me. So if they say you have to have a booster to work here, I'd get a boost, fine. And, if the person putting it in my arm, I'm not going to argue with them because they're just a messenger, right? There's no point in doing that. There's a higher up somewhere. Thank you, Westfield. Props to the 2 FDA docs resigning since they believe the push for boosters is political. If that's true, kudos. Yeah. Did children produce anti-nuclear capsid? They do, of course. There's one study that said they didn't, but that's almost certainly wrong because as Amy said, there's a ton of nuclear capsid protein in infected cells. Tanqueray weak in virology. TWIV. Absolutely. This doesn't have gin in it. It just has water. Isn't that a great mug, though? I love it. It's really cool. Only water. There's no downside to getting a third shot as far as I can tell. It's not going to give persisting high antibody levels, so you're going to have to keep doing it. My source of mainstream media is Amy. I don't really... People send me articles and I look at them, but I don't seek out my science information from mainstream media. I know where to go. I go to the literature. Let's find some contributions. So thank you, Mr. Ozzycam. I'm not mad at you. Why won't the USA sell Australia more Pfizer when they can't give it away? I don't know. If it were up to me, I'd sell it. Believe me, I think we should give away our excess vaccine. We don't need a booster. We're being a little selfish here. I'm sorry. If I were in charge, I would give you vaccine. If I were in charge, I'd make vaccines and drugs and give it away to the world. And I wouldn't last very long in office, as you might gather. Oh, boy. VNA. Let's see. Thank you, Ditching the Grind, for your contribution. All this goes towards the incubator, which should be up and running in a couple of weeks, as I said earlier. Lightning proximity alert. Remain sheltered for 30 minutes. This has been happening all day. Crazy. What happens to the S1 bound to ACE after S2? It falls away and it gets degraded. That's biology, right? Hoping for herd immunity like we have for measles, but we can't reach it for flu since immunity wanes there. Now, for flu, the virus changes antigenically, right? And so that you have to re-immunize. For the common cold coronas, they seem to change antigenically every 8 years or so, which probably, but we don't use vaccination to stop them because natural immunity, well, the infections are mild because of natural immunity. So even though they do change, it doesn't impact disease at all. So every virus is slightly different. They're alive attenuated, infectious, replication competent. Is there a authorized attenuated vaccine? I know that there were some in development, but I'm not sure that any of them are authorized yet. But they're certainly in development. Does the Janssen have any advantage or disadvantage in how the immune system responds? The Janssen vaccine is just delivering the gene encoding spike. So in that sense, it's similar to mRNA vaccines. The only question is that you can possibly deliver more mRNA to cells than the vaccines can deliver. And I'm speculating there. I'm not sure it's true. But I think in the end, they're doing the same thing. But the slightly better protection against severe disease with, well, actually, Janssen was just as good as the mRNA vaccines in protecting against death. So I think they're equivalent, really. You get frustrated with the huge number of anti-vaccine. I'm mostly not understanding why they are anti-vaccine. Wish I could talk to them, but some of them are so angry you can't talk to them, and I don't know why. I just want to know what your concerns are. I'd be happy to talk about them. I'm more frustrated with the wrong stuff going through the news cycle and prominent people like a virologist from Oxford saying herd immunity is a myth before we even have the data to say that. That really frustrates me more than anything else. My sister's physical therapist told her there's no science to support wearing masks. Give me an email, Vincent@microbe.tv. I've sent a few other people these articles. Yes, there is science for sure. Can you talk about vaccine safety during pregnancy? You know, there are a number of women who got pregnant during the first vaccine trials where no women were included. And then subsequently there were trials done in women, and there are no adverse effects in women that are pregnant. It is safe for them to take it, and it's far better than getting COVID because COVID in pregnant women can be really bad because they are immunosuppressed. What happens to old variants when they're displaced? Great question. Do old variants ever die, or do they just fade away? I love it. It's great. It's a good question. They probably disappear unless they've gone into some wild animals somewhere, right? And we don't know, and we probably will never know because we don't sample wild animals very much. So I'm assuming they just disappear because they're outcompeted by another variant, and they don't have a host to reproduce in anymore. But they could have a reservoir in animals, and as we do some sampling, maybe we'll pick it up. Great question. Can we do machine learning and deep learning to predict efficiently new variants? I think these technologies are immature because there's a lot of random aspects of the emergence of variants. So you could say, okay, these are 10 amino acids that would impact antibody binding, but you don't know which one is going to come up first. So then you could do which one is more likely to impinge on ACE2. You could do all of that, certainly, and model it. But I think you'd be wrong because there's a high stochastic nature to this as well. Doesn't always make sense, right? A lot of people are interested in this David Pakman show, huh? Cool. Well, as the K value, the over-dispersion constant for delta, not aware. That's a good question. I've been trying to find the data for a while now, but I don't know it. At 100K, I get a play button. Cool. I'll show it to you guys first. Should reach it at 92, right? Thank you, John, for your contribution. I very much appreciate it. Does the 15-minute guideline apply to Delta? Absolutely. Absolutely. Yeah. Absolutely. All right, let's see if we got some contributions. Thank you, Robert, for your contribution. Really appreciate your support of what we're doing. Thank you, Nathan, for your contribution. Really appreciate it. Every little bit helps. Does the U.S. have the largest voluntary placebo group ever? It does have a lot of placebo enrollees, for sure. What makes ivermectin so dangerous? Well, given at the proper dose, in humans it's not, but the veterinary doses are higher. So if you just plop a horse ivermectin into your mouth, it may be too much, and the drug binds to channels on nerve cells. That's how it kills the parasites, and it's going to alter your nervous function. So that's why it's potentially dangerous. Thank you, Mr. Ozzy Can. It was a stroke of genius to put the tracking chips in the ivermectin. That's pretty funny. Don't understand the need for fully vaccinated to wear masks, but not get booster when evidence for vaccine effectiveness is stronger than for masks. So I think the mask wearing is not solid either, but I'm willing to do that just in case. I'm not willing to take a booster because I think we should give it to other countries. But if you feel that way, it's totally, you're right. If we are at the point where the U.S. says, everyone can have a third dose, go for it if you want. I don't have an objection, but I just don't think the science is justifying it as a public health measure. Okay, lots of Rogan, but I don't really want to go there anymore. Thanks, Jennifer, for your support. Really appreciate it. Pac-Man is a decent person. Good. I would not want to be on a show with an indecent person. That would not be fun, right? Lots of great questions. We're going to have to skip till next time. Sarah, thank you so much for your contribution. Has anyone done cryo-EM of the N3 in the N-terminal domain on B1621? I'm not aware of it, Sarah. I'm sure if it's not done, it's going to be out there soon. How is there such a difference in doses? That's just what they decided to test in their preclinical studies, and they settled on it. They both work, clearly. Last week, Amy said you could have neutralizing antibodies that don't work. I don't know if she said that. I think she had said antibodies that bind but do not neutralize. I don't know what don't work would mean in this sense. Thank you, Ralph, for your contribution. Folks are amazing that you come back here, and here I am on 2 hours and got 771 people. I never ceases to amaze me. I'm wondering if this pandemic is over, most of you go away. We could still talk about viruses. They're pretty interesting. Viruses have a minimum number of virions required to initiate infection. That's right. What happens when a smaller number get in? They're overcome by defenses. There are lots of nonspecific defenses, right? Mucus, low pH, many other things than your innate immune response. And that can all stop a small number of viruses before they're able to establish an infection. The right number overwhelms all these defenses, and that causes your adaptive response to kick in. I have to wonder how many anti-vax influencers will have to get sick. I don't think that will matter at all, because I think they will recover and say it's no big deal for the most part, right? Thank you, Bonnie, for your contribution. Signed up for RSV vaccine trial for the elderly, but very few old people die why develop a vaccine if you're unlikely to die? So this is a vaccine specifically for the elderly, because the RSV, of course, in babies is a big deal. My understanding, Bonnie, is that it actually causes more significant death in elderly than you are suggesting. So just look for SARS-CoV-2 integration. Search for that. I just got another one this week. But if you can't find them, send me an email, Vincent@microbe.tv. I'll be happy to point them out to you. Thank you, R.M. Holtz, for your contribution for the cost of moving the polio doll. Yeah, it's the parking and the train, and then I just walk 2 blocks. Can you get on the list of 20 for TWIV 1000? So you're the first person that said it. So yes, I will put you on the list, but for the rest, we'll have to figure out how to make a list to get through. But, New York may not have so many people that want to do that. Have you tried to get on Bill Maher? I don't try and get on anything, folks. If people want me, they know where to find me. If you want me to go on, tell them to get me. I feel it's unseemly for me to say, get me on your show, right? I never do that. But someone told Lex Friedman, someone told David Packman. So tell people you want me on their show and I'll go on it. No problem. Why are you the liquid nitrogen changing person? Inquiring minds want to know. I change the liquid nitrogen, I change the carbon dioxide, and I do all the mouse inoculations and bleeding. Because I've done all that for 30 years, I know how to do it really well, and it's tricky, and I want it to get done properly. Thank you, Cat Vaxxer, for your contribution. I really appreciate it. And has long COVID been seen much in the vaccinated? That's the question we're waiting to hear. And Daniel Griffin last week said, we're waiting for the data. We don't know yet. Thank you, Ivan, for your contribution. Really appreciate it. I got Medigen subunit vaccine in Taiwan, no phase 3, EUA approved by immunobridging. Good antibody response compared. That's kind of risky because we don't know what level of antibody response would be needed. So they're making a big leap there. That's how you would license future vaccines where you can't do a control group, right? Because once you have an effective vaccine, you can no longer keep it back from people. You have to give people the standard of care, which would be the vaccine, so you can't have a control or placebo group. But if you know what the correlative antibody protection is, if you say number 20 is enough and this vaccine gets it, then you could license it. So they're going out a bit on a limb there. I hope it works out. Thank you for your contribution. Do I have to win a lottery? I don't know how we're going to sort it out. We'll see. We will see. Rose speaks. Hello, I haven't seen you in a while. Why aren't there any vaccines or antivirals for calicium or herpes? The feral cats in my village are dying of these, and the vet can't stop it. Well, it's in veterinary terms. It would have to be somewhere where the vaccines could be developed. And I can tell you that if lots of pets were dying in the U.S., it would be developed. So I think that's it. And, they have other priorities where you are, so the pets don't raise up to it. Oh, my coworker, I'm sorry if I keep answering these, but it's just too tempting. Lost her sense of taste. Could that be she's still carrying and transmitting COVID? No. These people are not carrying COVID, SARS-CoV-2 long-term. They're not transmitting. It's a long-term effect of the original infection. Thanks, Paul, for your contribution. Anyone have a study that confirms the SARS-CoV-2 specific IgA is present in mucosa post-vaccination? Yes, some studies have looked at mucosal IgA. Absolutely there. Yep. Some people argue they're healthy and strong, don't want a vaccine. Where do the benefits of natural immunity end? Well, you could be healthy and strong and have a good lifestyle, but you don't know if you're going to get serious disease or if you're going to get long COVID. It's a chance that you have to decide if it's worth taking. It's entirely up to you because no one is telling you to get the vaccine unless you are in certain workplaces where you have to do it. But you just can't tell if you're going to be the one that does well or not. Thank you, Westfield, for your contribution. Really appreciate it. Louis Russman said he sent you a message, wants to interview you for his audience, is willing to pay for your time. Can you please check? When somebody says they're going to pay me, I kind of turn it off because I don't want to be paid. I think someone wrote and said, I want you to look at these claims and tell me why they're wrong, and I'll pay you for your time. And I didn't particularly want to do that. All right, Louis Rossman. But I will not accept. He can make a contribution to the incubator. Pardon my insistence. I'm scheduled to receive J&J. My rheumatologist advised me to get Moderna. Well, you know, the blood clots are in a certain age group and in a certain sex, so you have to make sure you're in that group. And if you're not, then it's fine. Thank you, Tom, for your contribution. Greatly appreciated. Dan, thank you. Really appreciate it. Why would you wait until severe COVID to take monoclonals? Yeah, they should be taken as soon as you get your first positive test, but some people feel kind of crappy. They don't think twice. Then all of a sudden, one day they can't breathe and they go in the hospital, and that's when they get their monoclonals and it's too late. Yeah, you're right. You should, but many people are not tested early enough to do that. Thank you, Kent, for your contribution. Really appreciate it. Thank you, Adnan, for your contribution. You just discovered us through the Lex Friedman podcast. Wow, that's cool. First person coming over from Lex. Should be more, right, if he's got 1 million plus followers. Let's see if it works out. I mean, I think that's what we want to do, spread the word and get other people listening in. Thank you, Tavia, for your contribution. Really appreciate it. When can we visit the incubator and meet you? When it's all set up, right? Everything, all the equipment, all this furniture in place, which will probably be October, November-ish. And we'll announce it here and tell you how you can just come and visit. You can watch another alert. What do we got here? Flash flood warning, 2 a.m. You know when your phone buzzes and everything? Gosh, it's so disruptive. Thank you, Ian, for your contribution. Pronounced Kiora, very roughly. Thank you. Ian wrote me an email and explained that today. But we'll have people visit. Yeah, you can come and visit. You could watch a show being recorded. I'm going to have big monitors up so you can see the participants in any given show as you sit in the audience, right? That would be cool. I have it all thought out. Dan, thank you so much. Is booster immunity any different to monoclonal? Can't we just administer monoclonals to immunosuppressed populations? So if you're immunosuppressed, you're not going to respond to a vaccine, right? Not very well. So if you get sick, we give you a monoclonal, but you don't have long-lasting immunity from that. It only lasts perhaps a few months. So a vaccine is preferable, but if you can't make a response, then yes, you are in the population that should get a monoclonal. Thank you, Hannah, for your contribution. Really appreciate it. How many Americans have polio in their gut? I would say many of them do. In most countries, even if we don't see polio, there's circulation of polio. You can look in the sewage and find it. In fact, I've thought of having several of these people who are doing sewage look for polio as well. I think it would be in a large fraction of the population, but the CDC isn't looking for it. The N-word is narrative. Thank you very much. Narrative. I liked narrative. I came up with it months ago. Other people started using it to talk the narrative of variants, the narrative of transmission. And now last week people said they didn't like it anymore. It's not nonsense. Narrative. Oh, yeah. You could get a TWIV mug. If you're a contributor at Patreon, you'll get one. Just send me an email, vincent@microbe.tv. And otherwise, if you're not a contributor, you can go to cafepress.com/TWIV and you can order a mug. There you go. Seems like people like the Lex Friedman podcast. Thank you, AB. Donation for the incubator. Just thanks for clearing that up about a third shot. Not being unnecessary. As far as we can tell for most people. Immunosuppressed, kidney transplant people, it's needed, maybe older people. For most people, no. Thank you for your contribution. 38% of India, single dose, 11% double. 12 million vaccinated in a day. Yes, it's amazing. You've got so many people vaccinated. Good for you. But it's hard with so many people to get them all. I understand. Thank you for your contribution. Smallpox killed 300 to 500 million people in the 20th century alone. Humans lived with smallpox for thousands of years. Are we soft now? No, we're not soft, but we can prevent it. And why not? That's the job of public health, to keep people healthy and allow them to have productive lives. Can you argue against that? It's not a matter of softness. Thank you, Overjoyed, for your contribution. I'm glad we calmed you down, even though we get excited, right? Really appreciate it. I have to wrap up here. Ozzy Cam, thank you for your fourth contribution. Really appreciate it. SG, thank you. Is this virus a living being or just a complex chemical molecule? It's a complex chemical molecule. Completely passive, no sentience whatsoever. A complex chemical. We are lucky that we developed some kind of sentience just randomly. You know, Lex Friedman asked me what's the meaning of life. Well, I'll let you hear it because it's more fun to do that. I'm enjoying your virology videos, but I'm feeling I'm missing something. Some terms went over my head. Is there a prereq? Yeah, the prereq is biology and biochemistry, because that would help you get over it. But, and, you know, if you haven't done that, you might want to review it. Yeah, the buzzing phone means you should stay safe in the basement talking to us. I have done that, folks. I hope you enjoy. And by the way, I always do these live streams from here because they start at 8 p.m. and I don't want to be commuting back from the incubator at 10:30. I just want to go upstairs, have a glass of wine, and go to bed. Thank you for your contribution. Thank you for believing that knowledge should be freely shared. I do believe that. I think knowledge should be freely shared. However, tonight, the end of knowledge sharing, at least for now, although it really never ends. Thank you all for coming, all 770 of you, and your great questions. I'm very proud of your questions. And bring them back next week. We'll be here. And all of you, please be safe. And let's play a little bit of Nadia's as we wind this up. Good night, everybody. Be safe.